Do BBLs smell? Do people who have a BBL or Brazilian butt lift smell?
Former dancer here, and I can say, as a person who worked in the club with a lot of BBLs, there is a BBL smell.
Ladies and gentlemen, so apparently BBLs have a smell. They have a bad odor.
It's so mixed reviews, right? It's like, but the general consensus is saying that, yeah, they know somebody, guys will say that, yeah, they heard or that they experienced it firsthand. Women who said they're at the gym smelled it firsthand. Even like Gorgeous Doll said when she worked at the strip club, she can confirm that, yeah, some girls have this type of stench that's coming out. And then so many people are like, no, BBLs don't smell.
To the girl that got on here talking about how she had to get her BBL reduced because of a smell. Case in point, hold on. Because I ain't talking about nothing that.
That's what we're going to answer today. So in case by some chance you don't know what a BBL is, a BBL is basically a Brazilian butt lift where fat is removed from your flanks or your abdomen or your thighs, basically an area of your body where you feel like you have too much fat deposits, and it is transferred to your buttocks to improve the shape and to also increase the size. Some women and maybe even some men desire to have this procedure done. Now, I'm not here to condemn or to support those who choose to have a BBL. That's not what this video is about. This video is simply to answer the question, do people who have BBLs or get BBLs smell? There's a lot of talk on social media about the BBL smell, and I just ignored it, didn't want to address it because I just felt like this was just a trend. So I had no plans on addressing the subject, but a subscriber reached out to me on several occasions to ask the same question. Does BBLs smell, or does having a BBL cause you to smell? And so that is why I'm responding to this in video form, and hopefully you and anybody else who has thought about getting a BBL or has a BBL and just wants a different perspective, then hopefully this video will be helpful. People online have described the odor of a BBL or the BBL odor as being musty, sour, putrid. Someone said that it smelled like rotten broccoli. Of course, embarrassing. Having bad, what they call sit down air.
I had to come outside and talk about this because after what I just experienced, I'm traumatized. BBL smell is 100% real. I don't care what your mama say. I don't care what your friends say. I don't even care what your doctor say. BBL smell is real. And if you're wondering what it smells like broccoli. The broccoli that's been sitting in your pot with the top on for 2 days. We all know how that smells. Sour, funky, molded.
After you get a BBL or any surgery for that matter, any major surgery, especially if it requires drains, you will have a lot of bodily fluid, a lot of drainage because you've got, in many cases, drains. You've got blood, you've got all sorts of bodily fluids. And so for that reason, during the healing process, you will likely have an odor because keep in mind, when you went for surgery, that was the last time you took a bath, a proper bath. And usually for the first few days, you may not be allowed to take a bath. So again, during the early healing process, the first few days and maybe even the first couple of weeks, your garment is very dirty. A garment that's heavily stained with, again, different bodily fluids. It's hard to stay clean. You're in pain. You can't take a proper shower or a proper bath. Again, you've got tubes coming out of your body, or you've got open wounds, you're draining. So it is a mess.
What the fuck? It smells like bounce the fuck that ass.
So not only is your garment going to have an odor, especially if you've had to use the bathroom and you couldn't avoid getting some urine on the faja. Keep in mind, after surgery, you're supposed to keep on that faja pretty much 24/7. It has a built-in opening. So of course, you're going to have some accidents. Again, you're going to be dealing with a lot of secretions. Think about it. Blood, urine potentially, bodily fluids. You're probably also sweating. You've been wearing the same garment for a couple of days, especially if you don't have a replacement garment or you don't have, extra garments because they're so expensive. So that garment is going to have an odor to it. Even though you might be wearing it under clothes, and that is what people can smell. So a lot of times when you see a woman or a person out and about that may have had a BBL, they're more than likely wearing a faja or an undergarment on top of foams and a board and all sorts of other, clothing underneath their main clothing. So if those undergarments are dirty or sweaty or, have bodily fluids on them, even if it's dry, that's what you're going to be smelling when you see them. So it's obviously really important for you to keep your faja as clean as possible and to try to get a replacement. But again, I understand that it is very expensive. Some of you may not know what a faja is or why it's important, so I can't assume. Anyway, a faja is a compression garment that is worn after you get a Brazilian butt lift or BBL surgery, right? And so it's recommended to help reduce the swelling and also to help promote healing and maintain the shape of the newly contoured buttocks. So if you want good results on your BBL, you are encouraged to wear a faja. Every surgeon's guidelines when it comes to a faja might be different, but in general, depending on where you go, just in general, most women who get a BBL done are prepared to wear their faja for months. So there are guidelines where during the first 6 weeks, you wear the faja 24 hours a day and only take it off for bathing. Then after 6 weeks, you might reduce the time to 12 hours a day. There are all kinds of guidelines, and typically the stage 1 faja will change to a tighter faja later and then a really tight one after several weeks. So it's required that they wear this faja, but unfortunately, if you only have 1 or 2, it's going to be difficult to keep it clean. On top of that, you are told that you should wash it by hand, not by machine. So imagine if you are in pain and you don't have help, who is washing that faja by hand? Now, some of you who've never had a BBL might be wondering, why do they even need this whole faja? Why go through all that? Well, because the faja actually helps to maintain the shape while they're healing, and also it helps prevent blood circulation problems and also helps reduce the swelling and the bruising. And of course, it's providing compression and overall helps with the recovery process. Also, remember, depending on where they are in their journey, they might be wearing foam boards. They might even be wearing a waist trainer over the faja, and then they might be wearing compression socks. So there's a lot going on underneath their clothes that many of us who may not have had a BBL don't realize. But on top of that, it's all very expensive, really, when you think about it. The average cost of a BBL is about $5,000 in the US minimum, and then it can go up to about $18,000 depending on where you go. There's the plastic surgeon's fee, there's anesthesia, then you have to think about, the pain meds and the antibiotics that might be required. There's a cost to that. There's a cost to the healthy meals that you have to eat after the surgery. There's the aftercare. Some people choose to go to a center. There are things like lymphatic massages. There's a lot, not to mention, of course, all of the garments and things like pillows, a urinal, bed pads, antibacterial soaps, body wipes. So it's easy to see that for a lot of women, they have had to spend a lot of money to get that BBL. And maybe they can't afford to get another faja especially when they run around $200 if you try to get a custom faja. So it's quite possible that some women are rotating one or two fajas and not washing it frequently enough, which is why you get the odor. So the short of it is, a lot of what you're smelling when you see someone that has a BBL and they walk past you and it smells bad, or they sit next to you and it smells bad, more than likely it is the undergarments and all the layers that they're wearing underneath the clothes that you see. So that's one main reason. Now, assuming their faja and their undergarments and the foam board and all the things that they're wearing underneath their clothes is actually spanking clean, another reason you might smell an odor is because of poor hygiene. Partially because the person might be really uncomfortable or in pain and they can't properly wipe themselves. Many women that get these BBLs initially, the area or their buttocks might be very firm and apparently very tender to the touch, so they're not able to properly reach and clean themselves properly, or because of their poor technique, or because they are not used to the larger derriere that they now have, and it's hard to properly, again, clean themselves. Also keep in mind that when you get a BBL, and again, they are injecting fat into your buttocks, a lot of those wounds again are around your buttocks, but it's not that far necessarily from where, you do number 2 and where fecal matter comes out. And so again, they may not be properly wiping themselves. And so there is also a risk of infection, right? Because if some of that fecal matter gets into the wound, that can cause an infection. A third reason for why a person may have an odor after a BBL, which is very concerning, is if they have an infection, right? So if one of those openings from where there was, a drain placed, or where the actual, liposuction was, if that area gets infected, the person may have a strong odor, especially if they're having an odor weeks after the BBL. There's also a condition called fat necrosis. Fat necrosis is when you have fat cells that die, maybe because they might have pumped too much fat cells in that area, or you sat on it wrong for too long, or for whatever reason, you ended up killing some of the fat cells and you develop fat necrosis. Fat necrosis itself is not necessarily going to give you an odor if the skin is well healed over and there's no openings. But if you have fat necrosis, where there's a wound that is open and it gets infected, you can have a significant amount of pus or discharge, which will cause an odor, and that is very dangerous. So those are some of the general reasons why you might feel a person has an odor from a BBL.
So there's not a smell from the surgery specifically, but after surgery, it's hard to wipe down there. So if you do number 2 and you don't clean well, then you might have a smell.
I cannot believe I'm answering this, but I've had no less than 20 people ask this same question over the last 48 hours. So here we go. If you get fat necrosis after a BBL, does it smell? The simple answer is maybe. So if you have fat necrosis, meaning that some of the fat that was grafted doesn't make it, and you don't have a wound, you are not going to smell anything. Things that are inside of your body, under intact or closed skin, do not smell, even if that tissue dies. But if the areas of fat necrosis get infected and you have an opening in the skin, yes, they absolutely can smell, and some infections can smell really bad. The type of bugs that infect fat in that area tend to be bugs that have more of an odor, and it's not a fun thing to go through as a patient. So open wounds in general, even if they're not infected, typically do have a smell, and it's not too bothersome in general. I'm a surgeon, I know I'm used to things, but in general, it's not bad unless there is an infection on top of it. So fat necrosis in itself is not why someone would smell unless they have an infection or an open wound. The one thing I'll add, and I can't believe I'm making a video about this, is that very, very large BBLs typically come along with some hygiene issues. It makes hygiene harder, and so sometimes that can be associated with a smell. So
the past couple of weeks, there's been some debate about that. So I will tell you, the first couple of days, probably to a week and a half, there may be an odor. You know, your faja, you're sweating, there's fluid from the liposuction, there's blood from the surgery. That can all cause an odor. It shouldn't be overpowering, but it does have a little bit of an odor. Once your incision's closed, there's no reason you should have any type of odor. Usually when people get these dramatic BBLs where it's super large, it's a lot more area to clean, a lot more nooks and crannies. So you really got to get in there, keep everything clean, as well as when you start to sweat, those are more nooks and crannies for that sweat and stuff to build up. So remember, within the first couple of weeks, 2 weeks or so, yes, there's a smell. Afterwards, no, that is totally hygiene at that point. However, if your incisions are open and you notice a very overpowering smell, you should go to your surgeon to have them take a look at, because it could be a sign of infection that needs to be addressed. I'm Dr. Wilton Triggs, plastic and reconstructive surgeon. Hope this helps.
But just keep in mind, a BBL is a surgery, right? And so any major surgery in that area or around your abdomen or anywhere on your body that happens to get infected or is not cleaned well can potentially result in an odor. It's not specific to just BBLs. It just so happens that when women have a BBL and it happens to be so close to where, you have fecal matter, it's easier to get infected, or it's also more difficult to clean the area. And on top of that, they're wearing all these garments and layers, and they may be hot and sweaty. And so that's what's causing the odor. But in general, just to have a BBL and you are a healthy person and you are using proper technique and you are cleaning yourself well and you don't have an infection, there is no reason why a person who had a BBL should have any odor after they have properly healed. Right? So again, a lot of the odors you may expect happen in the beginning during the healing process, just like any other person who has any other surgery during that initial period. Just imagine, you might smell of hospital, or you might smell of the IV, or you might smell of the medicine, or you might just smell funky because you haven't been able to take a proper bath.
I've been hearing a lot about BBL smell, and I got a BBL, so I'm going to tell you how it smells. You do smell like hospital, as Mary Cosby would say, for a little while afterwards while you're leaking. I felt like it smelled like IV fluid and arnica gel, which is my nightmare. But once you're done leaking, you don't really smell. However, wearing the same faja every day will make you smell, so just buy 2. That's what I did. And then your foam boards that you have to like stuff into your faja, you just buy packs of those and just throw them away when they start being gross. Also, life hack, if you're getting a BBL, buy a shower curtain and then put like chucks on top of it, like they look like doggy potty pads. Okay, you put that on top, so then if you leak, it doesn't get onto your bed or anything, and it's easy to throw away when you're done leaking. Easy. That's what I did.
Case in point, hold on, because I ain't talking about nothing that. Don't be discouraged about getting your body done because something somebody said on the internet. But I don't have no smell.
And like I said earlier, I'm not necessarily in favor of getting a BBL, nor am I someone that condemns or feels like you shouldn't get a BBL. That's your choice. But anyway, just keep in mind that getting a BBL can be very dangerous, and you want to make sure, of course, that you see a plastic surgeon that is board certified, and make sure that the facility that they're doing the procedure in is accredited. Because if you're trying to cut costs and you're trying to go to someone who's just cheaper, that could cost you your life. And who wants to do that? Or cost you a very disfiguring body, for the rest of your life.
All right, I'm going to pivot a little bit. Some of y'all are so worried about the girls who got the BBLs and whether or not they smell, but you need to be worried about yourself, because some of y'all are real funky right now. Let's talk about it.
As a woman myself, I know we all get funky at some point. We all do. It's natural. But do yourself a favor, do your doctor and nurse a favor, and just make sure you clean up before you go see them. I know what it's like to come in for a pap. Please don't come in for your pap smear at the end of the day or the middle of the day after you've gone to the gym or you went running or whatever. It's not nice. It's not nice for them. And I think it should be embarrassing for you if you take your clothes off and the whole room smells bad. They may not necessarily tell you, but they're thinking it, and they may write it also in the chart, body odor. Yeah, so just make sure that you are cleaning yourself well. Take a shower before you go see your medical provider. Or if you're going to go get waxed, I'm sure there are these wax estheticians out there who are tired of smelling really bad, you know what, right? Try to make sure that you are clean and make sure that you've learned how to properly clean yourself front to back, because you don't want to give yourself a UTI. You don't want to be doing back to front, because what you're doing then is introducing fecal matter into your urethra, which can cause a UTI and also cause odor. Also keep in mind, if you just had intercourse and you go to see your doctor, and they have to go down there, it's going to be somewhat obvious, whether from the odor, whether from the discharge. The same thing can be said if you're going to get waxed. So just be mindful and be respectful, not just to yourself, but to the people who have to, examine you. And if you are informed that you do have a significant odor, or you feel like you have an odor down there, make sure you see your healthcare provider, because you might have an infection also. Because, for example, bacterial vaginosis can cause a significant odor. Women who get yeast infections may not necessarily have an odor, just in case you were thinking it, but they may have a lot of discharge, a whitish, cottagey discharge. That doesn't necessarily have a strong odor. But again, see your medical provider for that. Another tip I want to leave you with is, again, try to stay clean and dry during the warmer months. If you're a larger woman and you have a lot of folds, those areas of your body will trap sweat, trap bacteria, and cause you to have a lot of odor. So be mindful of that. Also, something that may be obvious to me and to many women, but not to everyone, is make sure you're using a wash rag, a dedicated wash rag for your private area, or a specific loafer, or silicone loafer, to scrub yourself, because soap and water is not enough, or standing underneath the shower and making the water run down you is not enough. It's not enough. So properly clean yourself. Yeah. Anyway, I hope these tips have been helpful, and I hope I've answered the question about the BBL smell. If you have any other questions, or if you have any other areas you would like me to discuss or cover, I particularly enjoy talking about women's health, but I certainly can also talk about health concerns related to men. In fact, I feel like I really should do that soon. I haven't done anything in a while specifically for men's health. Let me know in the comments if you would like me to cover that and what subject in particular. Okay, thanks for listening. Bye. Go take care of yourself. Actually, it's not bad.